Hello everybody, my name is Jon Puryear. I'm the owner of Jon Puryear EMSCE. I'm going to give you a quick overview of the current problem that cervical collars or C-collars are doing. So it's a lecture that I call Cervical Collars Helping or Hurting. Dr. Peirce is the medical director of Houston EMS in Houston, Texas. He presented a lecture at the 2010 Gathering of Eagles, showing some research that he, Dr. Hip, and Dr. Galeen did on cadavers, and it was called cervical collar or D-collar, C-collar or D-collar. Are cervical devices harmful? Now, their results was published in the Journal of Trauma, and it says that extrication collars can result in abnormal separation between vertebrae in the presence of dissociative injury. Now, their hypothesis is that current C-collars are creating distraction, or to make longer, stretching the spine in between the cervical vertebra. As you can see the Wilson ball there, when they tightened that cervical device, it lifted the ball up. As they applied it on a person, it appears that it lifted the head up. It caused distraction. So they wanted to prove that. So here we look into the body when they applied a cervical collar. And on the picture on the right, we can see that when you apply a normal C-collar, it now puts pressure on the mandible up underneath the ear, and then also on the shoulders on the trap muscles. Now, what does that do when you look inside of the body? Well, here on the picture on the right, we see that we have normal spaces in between the vertebrae, okay? But now we look at the C1 and C2 space, and it truly distracted or stretched, made longer that area. So it is creating distraction. This is a 19-year-old female auto pedestrian accident. You can see the picture on the left here to where we have the normal spaces in between the vertebrae, but we get to where the arrow is pointing at C1 and C2, and that caused distraction. As you see the fluoroscopy image, and it caused distraction here as well. Here's the big thing, though. They took her into surgery, and they opened her up to where they could see that injury. So when we cause distraction, when we are truly separating the space in between the vertebrae, it allows swelling to get inside of there, compressing the spinal cord. As Dr. Fowler says in his video in Do No Harm, most cervical injuries are not fractures at all. They are ligamentous injuries. Just like spraining your ankle, it becomes swollen and blue. Well, that swelling is now allowed to go into the spaces in between the vertebrae, compressing the spinal cord. Right there. That's where the injury may be done. Now, in their research, they used local EMS, medics, EMT basics, intermediate, paramedics, and they're going to use the national curriculum standard of care in immobilizing a patient on a long spine board with the application of a C-collar, of a cervical device. So think about how you are going to immobilize your patient. We're going to apply a C-collar, and then we're going to strap the patient down to a long spine board. Now, whether you use 3 straps or 4 straps or maybe even straps going over the shoulders or tiger straps or something to that manner, then do you make it to where the body does not move? No, the body is still going to move. Now let's look at the head. Now we put foam blocks next to their, head on each side of by the ears, and then we grab tape and we tape it on the C-collar to the backboard, and then a soft material strap going along the brow and the forehead down to the board. Now we are taping the head down to the board to where the head will not move. But if you accelerate or decelerate abruptly or go up or down stairs, the head doesn't move, but the body is still allowed to move slightly, so maybe we are still causing some type of distraction to the spine. But in their research, they applied the C-collar and put the cadaver on a long spine board, and then they're going to start looking at the cervical spine. So here is a fluoroscopy image, and you can see that their hypothesis is correct. You can see the distraction caused at C1 and C2. This picture is wonderful. This is without a C-collar and then with the C-collar. And look how much it actually stretches this cadaver's neck. Now, you may think to yourself is that collar is too big. They should have properly measured the C-collar for good, that's not right. Maybe you would have put a smaller C-collar on this patient. Well, but going by manufacturer recommendations, measuring, this is the proper collar. This is exactly what this patient should receive. Well, now they put the three-dimensional reconstructed tomography next to it so you can see exactly what's happening to this patient's cervical spine. Picture speaks 1,000 words, right? Now, here's the twisting. Now the head is restrained and the body is now twisted a little bit, and you can see that by the upper pictures there. Now, let me show you the upper right-hand picture so you can see, again, the distraction that's being caused in C1 and C2. But in this picture, we're looking straight down the spinal column. Each vertebra is a different color, so you can see how this area right here may be compressing the spine when the patient is tilted. Well, then they gave us a better picture than that. Look at the animation. So here we see that the spinal cord is going to lie about where my arrow is. And as the head is twisted, the base of the skull and the vertebra are going to compress the spinal cord. Pretty amazing. Now, there's a lot of articles that are being published right now over their research. I like this title. This author did a very good job. Collar Me Bad. This is in EMS Innovations of 2010. A.J. Heitman, the editor of GEMS magazine, has also published some articles on their research. And there's a lot of talk, a lot of buzz going on about their research. Now, there's another article that I would like to mention that was in the Journal of Trauma. And this says, Spine Immobilization and Penetrating Trauma, More Harm Than Good? Well, their studies showed that unadjusted mortality was twice as high in spine immobilized patients. Their conclusion is pre-hospital spine immobilization is associated with higher mortality in penetrating trauma and should not be routinely used in every patient with penetrating trauma. Well, think about why. Where does your penetrating trauma patient need to be? They need to be at definitive care. They need to be in an operating room so they can plug the leak. So the time that it takes us to properly immobilize that patient may be worse than good. So the new term in cervical spine management is now called cervical splinting. As the video that Dr. Fowler did, cervical splinting is trying to splint the cervical spine in the position found, without creating distraction. Now, the only device that I have seen out there personally that accomplishes this goal and these objectives is called the X-Collar, made by EMSWorld LLC. They also have the X-Collar Plus, and the Plus is their head restraint system. The head restraint system integrates into the X-Collar, preventing the head from coming up off of the board and the vibration, but it now allows the head to move with the body, preventing the distraction injuries. The other thing that this device does is say that your patient's head is turned to the side and you have neurological deficit or you meet resistance, the patient has pain when you go to move their spine in an inline neutral position. Then you would need to split the cervical spine in the position found. The X-Collar will allow you to splint your patient in the position found. So I hope that I've kind of given you a little insight to the Dr. Galeen, Dr. Hipp, and Dr. Purse, their study. And please check out my website for a little bit more continuing education if that's what you're looking for. Thank you very much, and God bless you.